So sort of changing gears here, when we talk about this idea of death and dying, our society is going to view death maybe potentially a little differently than you do. In addition to that, you may particularly view death differently, especially when you get into this field, due to the fact that you're going to be exposed to it. But maybe for some of you, death is a little different. Death is viewed differently because of the fact that you haven't had maybe a huge exposure to it. But as you sort of, spend more time in the pre-hospital realm, as you interact with more patients, there is a good possibility that you're going to be exposed to death. And so it's a good idea that you kind of keep an open mind as far as how our society views this. One of the things is that there is no doubt that the life expectancy of people has increased. Before, when we didn't have as very many advances in medicine, people weren't living as long due to the fact that there wasn't cures for different things, there wasn't treatments for certain things for people to live a little longer. In addition to that, the family mobility may mean less support for the grieving people. Maybe back in the day when families were a little bit more or less busy, more together, families weren't spread out in various different states, the family structure back in the day might have been more available to assist each other in sort of the grieving process of a family member or a loved one passing away. But that may not be the case in our society or the folks that we interact with. In addition to that, death no longer occurs in our home. Death and dying can occur in the hospital. It can occur on an accident scene, such as highways. And this may be a view that society views death. And this is just to keep an open mind of the fact that when you're coming up on a patient or a family member that has seen this or is experiencing a loved one passing away, they may be in shock because they never expected that to be the case. In addition to that, family members might also believe that, the death of their loved one shouldn't be in their home, and that there should be like a funeral home coming to pick them up, and that, the dead body shouldn't be there. And that's changed in society because things don't happen as quickly, and for folks that are in our society that don't see this kind of thing, they may not realize that this has changed, and that, there may be a dead body in their room or in their home for a lot longer than they sort of expected, due to the fact that it takes time. And so we need to keep an open mind in that situation. In addition to all of this, I want you all to keep an open mind if you haven't experienced death or dying. It's something that if you choose to continue in this career, this is going to be something that you are going to experience. This is going to be something that you're going to have to face. The fact of the matter is, if you get into this work, you're going to see people die. You're going to interact with people that have already died. And that's just part of this job. We are called for medical conditions, and one of those are somebody has died. In addition to that, one of the things that's kind of most important in this situation is the fact that you are going to be expected to deliver care to a person that's dead. And the question is, how are you going to do that? Are you going to freeze up and kind of freak out and get a little scared? Potentially, maybe initially for the first time. But as time goes on, you're going to have to rely on your skills and your training and those kind of things to deliver care to that person that's dead, and come to grips with they don't look the greatest. For some of you, it's going to seem like they look like they're from some sort of horror movie, or potentially it's going to look a little scary, and you're going to be nervous, and you're not going to know what to do initially, and you're kind of going to freak out. But the real thing is you do know what to do, and you are going to be provided the correct tools and training necessary to react in these particular situations.